There's a large need for mental health services here in the Permian Basin, with those in need of support often turning to the police or emergency rooms. And while those staff does the best it can, they can't exactly help or qualified people to help the cause always. That's reality is why the Permian Basin Behavioral Health Center is on the way. Tyler Dupnick tells us more now about the update on that project. Tyler, how's this coming here?
Well, Alex, leaders of the project are now in the final phases of the design and work on the facility. Permian Basin Behavioral Health Center is a healthcare facility that will add new mental health services to our region. And as work continues on it, clinical programming is an integral part of the role it will serve our communities.
Building the foundation,
it's 141,000 tons of dirt,
is about more than just dirt.
We are trying to really identify all of the services that we're going to offer.
Stephanie Caples is the clinical programming consultant for the Permian Basin Behavioral Health Center.
Services means what type of therapy or what modalities, but really importantly is what patient populations are we going to serve. We have a huge gap in our community as certain patient populations are not able to receive services for a lot of different reasons, so we want to close that gap.
Clinical programming does not just deal with services.
Developing the workforce, which means educating the workforce. So we're creating programs that currently in our community don't exist, like a behavioral health technician program, and we're creating pathways to make sure that the learners and the students that want to go into those programs have an identified path for how they can achieve their goals, whether it's to become a behavioral health tech and stay that for the career, or if they want to get a master's degree in psychology, social work, or even become a psychiatrist. We're creating that pathway.
Pathway efforts are being made at Midland College, Odessa College, UTPB, and Sul Ross State.
The Permian Basin Behavioral Health Center's goal is to not just treat all of our Permian Basin community, so not just Midland, Odessa, but the entire community, but we want to educate all of the learners in the West Texas community that are interested in a career in nursing or in behavioral health, mental health.
As the process rolls on, clinical programming is foundational.
We will continue to do our educational and workforce development programs. We will also be really trying to solidify the operations of what's going to happen at the hospital. How is it going to function? Who are we going to see? What quality standards are we going to have, which are very high quality standards at this point, but how are we going to ensure that? So all of that has to come together simultaneously over the next 2 years.
Now, the hope is still to open the Permian Basin Behavioral Health Center at the end of 2025. Caples told me that they will be touring the Menninger Mental Health Facility in Houston, a premier facility in the nation, for service ideas that they could potentially tailor here to meet the needs of our Permian Basin population.